Hi, I'm Lucas Buchler. I'm an assistant professor of orthopedic surgery and sports medicine at Northwestern Medicine and assistant team physician for the Chicago Cubs. Orthopedic injuries in athletics, and especially high-level athletics, are incredibly common. This year it seems that there's been an upswing in muscular injuries, especially hamstring injuries, groin injuries, abdominal injuries in baseball players at the Major League Baseball level. There's a lot of different theories out there of what may cause this. There's been some really good research done on adaptive change to musculoskeletal tissues through the course of a professional baseball season. For example, the ulnar collateral ligament in the elbow will hypertrophy and change in structure over the course of the season, and then it will return to a normal state with a period of rest. It's hard to know if the pandemic plays any role in these muscular injuries, but it certainly hasn't been a normal year, and there's a lot of theory that maybe some of the normal adaptive change is taking some time to catch up so that the players can tolerate the amount of force that they're putting through those muscles and tendons. It has less to do with preparation and what we would say is being game ready or in game shape. These players are professionals. They take care of themselves. They train very hard. They do everything they can to be prepared, but there's not much of anything that can prepare the same way as playing baseball every single day. And we tend to see more muscular injuries in baseball compared to other sports. Again, there's a lot of theories for why that may be. Baseball is a more explosive sport than most folks give it credit for. In baseball, people are typically standing still and then moving or running at full speed, compared to other sports where players are in dynamic motion and then speeding up and slowing down. I think that puts the muscles more at risk. When it comes to preventing soft tissue injuries, the most important thing is preparation and gradual progression. We speak with not just our athletes about this, but patients in the office about this every day, about the importance of gradually increasing their activity and not making large leaps and bounds in terms of increasing activity. When it comes to muscular injuries in the athletes, we rely on a number of techniques to evaluate for the severity of the injury. Most of the diagnosis will be made by history and physical exam. Occasionally, we will get advanced imaging with an MRI of the muscle to further understand the structural injury, the severity of the injury, or especially if we're concerned that there's been a tendinous avulsion off of the bone, we'll have a low threshold to get more information with an MRI. The vast majority of muscular injuries we will treat non-surgically. In rare cases, the muscular injury, rather than being in the mid-belly of the muscle, is a tendinous avulsion either at its origin or insertion. Those we're more apt to treat surgically and will typically evaluate further with advanced imaging and an MRI. I think the biggest takeaway in the current environment is that we need to be vigilant for these injuries, not just in our athletes, but our patients in general. This has been an odd year. Patients have not been nearly as active as they were 2 years ago. Many will be looking to return to their previous level of activity and will probably be more at risk for muscular injuries.